Good evening and welcome to a special edition of Pull. Tonight, a day in the life of an Afghan American doctor. We'll speak with two doctors who work in the Washington, D.C. area, and we'll travel to the D.C. Veterans Hospital for a first-hand look at a surgical procedure. But first, I'll speak with Saba Ghareb, an Afghan American student who works at the emergency room at the George Washington University Hospital as she prepares to enter medical school this year.
If you're not healthy, if you're not living a quality life, then really what's the point of living? What's the point of having great streets and roadways if you're not healthy to enjoy it? Ever since I can remember, I've wanted to be a doctor. So it's always been my dream and I've never wavered. It's never been like, I've never doubted my decision to pursue medicine. Growing up in Afghanistan, I was sick often, and maybe that was when I first got exposed and kind of like saw medicine and such.
When did your family come here from Afghanistan?
My family came to the U.S. in '95. My mom actually won the lottery for the State Department DV lottery for that year, so that's how my family got the opportunity to come to the U.S.
And how old were you then?
I was 8.
So you were 8. So you remember a good part of Afghanistan.
And I've visited since then.
You're currently an undergraduate here at George Washington University, and your major has been public health.
Yes.
What kind of classes first are you taking with that degree?
It's a lot of public health type classes, so it's environmental health, preventive medicine, health policy. So, I mean, public health has so many different realms. There's policy, there's management, there's things on the global health, things on the ground you do. So I've been taking a little bit of everything and kind of figuring out which aspect of public health I really like. In addition to that, I've been taking pre-med classes that I need, such as organic chemistry, physics, general chemistry, biology, things I need to go to medical school.
And how do you think the overall public health program will, get you prepared for medical school?
You learn, I mean, medicine, the way we've been taught, medicine doctors, they treat patients one-on-one, whereas public health workers treat the community. So I like getting that field where how do you deal with this disease outbreak, how do you help someone on a larger scale, and then inshallah when I go to medical school I'll learn about medicine and treating people individually, so it kind of gives me a good balance of working with the community as well as with individuals.
And you've already been accepted to the medical program at George Washington. Congratulations. And I'm just wondering, what have you thought about what the most challenging part of medical school may be?
Probably the workload. Everyone I've talked to who's in medical school has told me it's really hard, you're going to have to study, a lot. So I understand it's going to be very challenging. I just want to succeed, and it's one of those things where I don't want to just study and then pass an exam. I want to study, pass the exam, and then remember everything, retain the information, because obviously I'll need it, and I feel it's a lot more responsibility knowing that information.
And do you plan on ever returning back to Afghanistan to use those skills?
Of course, of course. That's always been the thing. Ever since I was young, I knew when I came to the U.S. and started going to school and really worked hard, I knew that one day when I became a doctor, I'd go back to Afghanistan, but also other countries like India, Bangladesh, other countries that are having problems. It's always been a dream to go back and give to the people that need it the most.
Well, right now you've been working as an emergency room technician.
Yes.
And what is the average day like when you come in here and you put on your outfit to be an emergency room technician? What's that like?
Well, you clock in, and our shifts are long. We usually work 12-hour shifts. So you're assigned to a team with a doctor and 2 nurses. So every time I work with 2 doctors and 2 nurses, and we get patients added to our service. And each patient, obviously because it's the emergency room, we get all kinds of sicknesses and illnesses. You just kind of go into the room, take care of that patient. If the doctor orders blood work, you draw blood. If they order EKGs, whatever test they order. If they have a broken bone, they need a splint, you do that. If it's a trauma, someone comes in from a car accident, you just gotta expect the unexpected. You gotta go into the room, and whatever needs to be done, you gotta be ready to do it.
You mentioned, dealing with the unexpected on a daily basis. What do you think has been the most surprising thing that you've had to deal with so far?
Wow. I think some of the scarier things are when you see really young people die or have a really, really bad injury that they're not going to recover from, because I'm young and then it just hits home. I remember on my first day of work, there was a 21-year-old patient who had cardiac arrest and he died, and that's the first time I had seen someone die, and it was very scary, it was very shocking, but since then I've learned to cope with it. I don't get attached emotionally. I learned to separate myself, so when I leave work, I kind of leave work at work.
But is that difficult to do?
Yeah, it's difficult. When I first worked here, there'd be times when I'd leave work in tears just because I would be so emotionally drained, seeing someone die, seeing someone young be really hurt. I just get really drained, and I learned that I can't practice medicine if I don't learn to separate my feelings from my job.
If somebody sees someone who has had a traumatic injury right before them, do you have any tips on how they can handle that kind of situation?
Stay calm. I'm one of those people that if something comes in, something crazy, in the beginning my heart would start pounding, I'd get so excited, but now when it comes in, you gotta stay calm. Because if you can't stay calm, you can't decide what to do. You can't decide what's the right thing to do. You can't see the bigger picture. So I think the most important thing when you're dealing with a traumatic situation and it's a stressful health-related issue, just to stay calm so you know what to do.
And you know, unfortunately, Alvaro, dealing with sometimes explosive devices or even landmines in some areas, are there any tips someone could use if they end up seeing someone go through that situation in terms of just helping them out at that moment?
I would say getting help, and if they're bleeding, trying to figure out where they're bleeding from and trying to stop the bleeding. Holding pressure on a wound and just preventing the person from just bleeding so much. I think that in itself, out on the street, if you're a bystander, is enough.
And in terms of your experience working as an ER technician, are there any concepts or ideas that you've learned that you think you'll take with you as a doctor?
Yes. The one thing I've learned from working here, if anything else, it's how to interact with patients. Like I'm not nervous to go deal with someone who is thinking about killing himself. I'm not nervous to go into a room and tell someone they broke a huge bone. I'm not nervous to deal with patients. I'm very comfortable. I know how to act around patients. I know how to react to them. I know how to stay serious. I think that's the main important thing. Sometimes you go into medicine, you think it's all about studying, but a big part of it's communication and interpersonal skills and learning how to deal with people.
And you mentioned, wanting to be a doctor since you were very young. Yeah. Do you have any advice for young Afghans who may be considering pursuing a career in medicine like yourself?
I would say don't give up. There's so many times, there's so many obstacles that come your way, just because it's not an easy road to follow, especially if you're a woman. There's just so much blockages that come out. Just don't give up. Just keep pushing, keep trying your options, and if you think that something's out of reach, still strive for it, because chances are you might get it. Just believe in yourself, because there's so many times when I've been like, I don't think if I can do this, and then I've come out of it doing great.
And what do you think is the best memory you'll take away from this experience so far as an emergency room technician?
There's those moments, there's those patients you remember who you've really helped, who've touched your life, you've learned something, and ultimately I've learned to appreciate life so much more. Although I'm only 22 years old, I am unlike my friends because I act so much older and wiser, because I know what it's like to be sick. I know what it's like to just be down in the dirt and just to know how that feels, and I've learned to appreciate that, and I thank God for what I have. So a lot of people my age don't have that mentality, and I've learned that at a young age.
Well, Saba, I want to thank you for your time and allowing us to take a look inside your work as an emergency room technician. Thank you.
Thank you for coming.
Thank you. When we return, we'll take a closer look inside an operating room with an Afghan American doctor who helps American veterans. And what is this process called?
This is called scrubbing in.
And why is hygiene important, just for health reasons?
It's both for health reasons and for surgery in specific. I don't want to be spreading the germs of one patient to another. And there's actually a timer on the sink here. I'm supposed to scrub or wash my hands for 3 minutes total. So I start off with my nails, something as simple as soap and water, just to wash your hands after anything that you do. So sneezing, when you cover your sneeze or cover your cough, wash your hands after.
I'm here with Dr. Hosai Hisham, an ear, nose, and throat specialist here at the Washington, D.C. Veterans Hospital. Salam, Doctor.
Salam alaikum.
I want to ask you first, what is kind of your normal day here at the hospital?
It depends on the day. I come to the hospital, I check my email, check my notes, things that need to be done, and then probably I'd review the patients that I'm going to be either operating on, and maybe the night before I had read up on the procedure. It's always good to, even if you've done a few of them, to just kind of do a little reminder reading ahead of time.
So it's constant learning?
Always, always, always. Every patient's different, so you have to be prepared for those unexpected situations.
So you're going to be performing an actual throat cancer surgery later. What kind of treatment did you try before resorting to surgery?
Sure. This gentleman was diagnosed with throat cancer about more than a year ago. And based on the location of his cancer and the size of it, it was deemed appropriate that he could be treated with chemotherapy and radiation. And majority of the time, that's successful. Unfortunately, for this gentleman, after his treatment ended in August, and it looked like the tumor had been eradicated, and on monthly follow-up, we eventually noted that he had a recurrent spot of cancers.
What is the main cause of this kind of disease?
Number one cause of cancer of the head and neck is smoking tobacco. There's also additional additive factors with alcohol consumption, but smoking is the number one cause. So right now, we're basically in the beginnings of our procedure. We talked about getting most of the surgical training throughout your residency, and this is what they're doing. So Dr. Witcherly is first assisting, Dr. Gordiani second assistant in this procedure. Majority of the procedure is done by me under my supervision, but they will be doing some of the more important parts of the procedure that will fine-tune their skills. And as Dr. Witcherly is going to be graduating in the upcoming year, he'll be able to do these things without supervision.
So obviously training, for performing surgery is a very complicated procedure. What keeps you motivated?
That's a good question. I think it's everything from the interest in whatever field that you choose, to the patients that you take care of, to whatever drives you or motivates you to pursue any profession. So it's a combination of many things, and it's very personal. And I can see a lot of people definitely burning out, and they need reminders as they're going through training.
What kind of skills or attributes do you think is helpful for a doctor to develop?
I think work ethic, just like any other field. Other than that, things like patience, perseverance. Almost everyone in medical school or in college, they have the intelligence to do the things that that you need to do to succeed. But like you mentioned previously, motivation is a big factor. So you have to find things to keep yourself motivated and prevent that burnout that a lot of people can experience.
So you're practicing here, we're here in a veterans hospital. Veterans are individuals who have served in the active military forces of the United States. We know that right now there are numerous troops in Afghanistan from the US and a recent troop increase. Have you, during your time here, seen any soldiers who served in Afghanistan who were treated here for injuries?
We are seeing a lot of Iraqi veterans and Afghan veterans recently who have been transitioning from active military status to retired or off duty. So,
and what kind of injuries have they usually sustained? What are typical?
Anything from blunt trauma, things that they experience from IUD explosions, and that could be as disfiguring as having facial deformities, etc., to just having traumatic brain injury, where they may not have any external injuries at all, but the shock to their brain or having a kind of traumatic concussion has resulted in aftermath neurologic and psychiatric issues.
Have you treated any veterans from Afghanistan?
Definitely, yeah. In the last probably few months, we're seeing more and more of them.
And as an Afghan American doctor, how did they react to you?
I think they see me as their doctor. Most people don't make the connection initially, but once you gain that trust and you're treating them as your patient, and they know that you're taking care of them, and it really doesn't matter.
But do you feel that they want to share more with you of what they saw there? Because
they definitely do. They're like, oh, where are you from? I've been to Kabul, or I've been to Kandahar, and they might know more about those areas than I do at this particular time, because my memory of Afghanistan, it's from the 80s, and things definitely have changed a lot. So yeah, they do want to relate, and they want to have that conversation. It's, to tell you the truth, it's sad for me. So I try to talk to them as much as I can, but sometimes it's difficult to to continue that conversation.
And lastly, as an Afghan American doctor, especially someone who's a woman, what advice would you give, our Afghan audience about, pursuing a medical career?
I think there's a lot of things. Hard work is one. Not giving up is another. And more importantly, I think it's never about timing. It's all, a lot of people concentrate on having to do things in a certain particular order. I know people who went straight from high school to college to medical school. I know people who tried other professions and then they decided to go into medical school. If you have the time and, the luxury of being able to dedicate that towards pursuing your education, you can do it. It's just, perseverance is the key.
Thank you, Dr. Hisham, for your time and for sharing your experiences as an ear, nose, and throat specialist.
You're welcome. Thank you very much.
When we come back, a conversation with an Afghan American doctor who specializes in internal medicine. Joining me now is Dr. Wasil Akbari, a doctor of internal medicine from Northern Virginia. Thank you, Dr. Akbari, for joining us.
It's my pleasure.
I want to ask you a little bit about your background, like how long you've been in the United States and when you first decided you wanted to become a doctor.
I have been in the United States more than 30 years now. I left the country in Afghanistan in 1979. Ever since I was a child, back on my days when I was in Amani High School, wanted to become a physician, so that's been a long-term planning for me, and especially when my sister passed away. When I experienced that back in Germany, it kind of gave me more motivation to become a physician.
What was the most challenging part of going to medical school?
I think for me, because I had just came into this country, there was a lot of things that I didn't know. For example, didn't know a lot of friends, didn't know a lot of relatives that have been in medical, like for example, Afghan relatives that could help me. That was very challenging to find all those and make sure that you get the proper grades and make sure that you get the right numbers so you can enter to medical school. My father worked for the Afghanistan Bank, had no background. I came up here and he had to start from basically from zero. So he was pretty much busy trying to provide for the house, for the family. My mom, who never worked back in Afghanistan, had to learn English and try to work here in the United States. So I was kind of left alone by myself. I had to explore all that by myself, but it was a good challenge.
Here in the United States, 1 year of medical school, you do something called rotations. Can you explain what that is and why that's important?
After 4 years of college, you will apply to go into medical school, and that's an additional 4 years on top of 4 years of undergraduate studies. When you finish the 4 years, you will become a physician, but you cannot practice medicine until you do your residency, which could be anywhere between 3 years up to 5 years, depending on the specialties that you choose. If you finish 3 years, you become a general practitioner. You could practice, either join a group in the hospital, a group of physicians, or open your own practice.
During that process for medical residents, there's these long hours, as you mentioned. How do you think that prepares you to be a better doctor?
I think it's a very important training program that everyone should have, and I hope that someday in Afghanistan we'll have something similar. Because medicine, there's such a vast knowledge, and you cannot learn that in 2 days or 1 week, even if you read a book over and over. It's only when you do the practical work every day, whether you like it or not, it becomes a learned behavior kind of type of thing. Those hours, initially we all complain about it, but now that when you sit back, think about it, it was because of those hours that you become a good doctor. If you didn't have it, you won't be a good doctor.
And what is the experience like when you're going from all of this classroom instruction, like you said, to then actually treating your first real patient?
What's different, once you become the first year intern, all of a sudden all the responsibility is on your shoulder. Not only you're trying to learn, you're also held accountable if something goes wrong. So that's very stressful, especially on your first night or first day.
Yeah, and in treating a patient, you have to know about their rights. Can you tell us about that?
In other countries, and unfortunately back in Afghanistan also, A lot of times there's no privacy. Sometimes patients are seeing in the hallway, I mean, and with all other people watching, and that's very sad.
As we know, healthcare is something that's a problem worldwide in terms of access. And many people don't realize that in the United States, there's many patients who don't have the resources to get the medical care that they need. Is that a problem here?
Of course it is. I mean, especially it's a financial problem, not only for the patients, but also for the physicians. Not everybody are willing to see patients either for free or for just a lower service if they know that they do not have coverage. That's something that we're hoping that will change with all the changes that come in with the healthcare plans that the Congress and everyone is talking about.
Can you tell us what a typical day is for you?
I'm mainly in the office. I go in, I see anywhere between 20 to 22 patients per day. I have support staff which consists of a secretary, a nurse that brings in the patient into the room, they take their vital signs, and then I go see the patients. And we are a completely electronic system. We don't have any charts or anything. Everything is on the computer.
Do you have Afghan patients that you treat that come to you because you know?
So I do see a lot of Afghans, and I also see a lot of Iranian patients because we speak the Farsi.
And what are some of the common problems that you see your patients encountering here?
The most common problem here, because of the harsh economic times, a lot of patients do not come back when you ask them to come back in 2 weeks, in 3 weeks. And the reason I say that is because that's a common problem back in Afghanistan. I have noticed that a lot of people have high blood pressure, and that's one of the major risk factors for stroke. And patients go in and see a physician, they give him a medication, and their blood pressure is coming down back into normal. After a couple of days, they stop taking their medications because they realize they're better. They don't need to go see their doctor again.
As we know, many Afghans don't have access to medical care. Are there any practical tips you can give, any kind of home remedies that they could use to prevent illness?
The major one in Afghanistan is our salt intake. As you know, the salt in Afghanistan is not the purified salt that we have here in the United States. Some of these salts they're just coming from the mines, and they're very enriched. So it's good to decrease salt in the diet. Number two, also a diet. Everything in Afghanistan is either fried in oil or is with a high cholesterol. To decrease the intake of those and take a lot of vegetables, a lot of fresh fruits, that helps with people.
But in Afghanistan, diabetes is also a big problem. What can people do to prevent some of that?
Diabetes, when I see my patients in the office, I tell them when it comes to treatment of diabetes, my job is about 40%, yours is about 60%. And they look at me, they go, "What do you mean, doctor?" I tell them on how important it is to always take your medications, do a little bit of exercise, and to lose weight. And rice and bread, a major source of carbohydrate. If you take too much of it, it all becomes glucose and increases your sugar level.
I really appreciate your time coming in.
Thank you for having me.
Experience. My thanks to Dr. Wasil Akbari, Sabah Horeb, Dr. Hosai Hosham, the DC Veterans Hospital, and the George Washington University Hospital. We'd love to hear what you think about this or any other poll program. Just go online to aamtv.tv or tolo.tv. See you next week for another edition of Poll.